This is USVI News, your Virgin Islands connection.
Hello, everyone. Thanks so much for joining us today for this edition of USVI News, the Virgin Island Connection. I'm Brissa Bradfield. Emily Matson has the day off. Well, we start today in St. Thomas, where a 59-year-old man was pronounced dead after losing control of his motorcycle in the area of Estate Canaan. The victim, who has been identified as 59-year-old Vincent Henley, was driving his motorcycle westward from Magens Bay on Sunday just after 4 o'clock when he lost control and collided with a rock. He was thrown from his motorcycle and struck a large rock. No other vehicles were involved in the collision, and Henley was pronounced dead on the scene. Well, meantime, the November election is now just 3 weeks away. The big race on the ticket is, of course, for Virgin Islands governor and many Senate races, too. And there are many issues affecting the VI, from education to infrastructure to policing. So Island Analytics and Marketing wants to know where you stand and what's important to you. They've launched a USVI General Election Survey to collect the opinions of USVI residents about the candidates running in the November 8th VI elections, and also your thoughts on the critical issues affecting the quality of life in the U.S. Virgin Islands, the issues that matter to you the most. EM is doing the survey to try and get take on the community on their candidates and how they're doing. Participation in the election survey is anonymous, and EM is not affiliated with any political campaign. The results are expected October 31st. To find more information, you can do that at usvicbs.com. Well, meantime, where air travelers are avoiding checking baggage when they fly. A September survey indicates that 60% of flyers reported some kind of disruption while traveling by air this summer. Of the 1,700 Americans in the Tripit Survey, 1 in 6 said their luggage was lost or delayed. Now, that tracks with federal statistics that show more than 1.7 million bags were mishandled last year by U.S. carriers. The survey also shows that 41% of flyers now say they will avoid checking their bag in the future. 23% say they will use their own bag tracking technology like an Apple AirTag if they do. Transportation experts agree that staffing shortages at airports combined with a high level of demand are the root of the problem. And it's being hailed as a historic ruling, making hearing aids more accessible and cost-effective. Adults will soon be able to buy hearing aids over the counter. Tanya Backus has more on what this means for consumers.
Millions of Americans will soon have access to over-the-counter hearing aids. The FDA issued its ruling in August, allowing people who feel they have mild to moderate hearing loss to buy the devices without a prescription directly from stores or online.
Hearing loss is very common, but that doesn't mean that it's something that's normal or that needs to be tolerated.
American Academy of Audiology President Dr. Sarah Sitlowski also works at the Cleveland Clinic. She says research shows hearing loss can impact many aspects of health.
It can be related to cognitive decline, to depression, to anxiety, to social isolation. It's really a sense that is so important for maintaining a very positive quality of life. It's how we stay connected and sharp and happy when we're aging.
Hearing loss is the third most common chronic health condition in older adults. It's estimated hearing aids could benefit about 30 million Americans. Dr. Sitlowski says over-the-counter aids are an appropriate first step for some patients.
People who are starting to notice that they're having a little bit of difficulty. It's not for someone who has a more significant hearing loss, who has trouble in multiple situations, who has hearing loss only in one ear, or a sudden loss, or ringing only in one ear. Those are all reasons that you absolutely need to see an audiologist.
Consumers should be sure to check the return policy. The FDA does not require the devices are returnable, but the policy must be on the package.
And the American Academy of Audiology recommends seeing an audiologist first to test your hearing and to determine if you're a good candidate for the over-the-counter hearing aids. Well, meantime, with families facing record inflation, we're all looking to stretch our dollars a bit more, especially in the kitchen. We're seeing rising grocery store prices. According to the FDA, Americans throw away an estimated $161 billion worth of food every year. And a quick scan of your pantry or fridge could reveal a few items past their expiration dates. But should you throw them out, and what's still safe to eat? Well, Vicki Wynn clears up the confusion on date labels so you're not wasting money or food.
From use before and sell by to expires on, date labels on packaged foods like milk, meat, juice, and pantry goods, opening a can of confusion. The variety of terms can make it tough for you to figure out what can stay and what must go. One survey revealing more than 90% of consumers report throwing away food too early because they misinterpret the labels. The average family of 4 losing $1,500 a year to uneaten food.
Every week is something new. It's beef prices, it's produce, it's avocados.
You can't hardly afford food. I mean, it's gone crazy.
All this coming as inflation sends grocery prices up 13.5% from last year.
A product can be beyond the best if used by date and still be safe and of appropriate quality for consumers to use.
Susan Main serves as director of the Center for Food Safety and Applied Nutrition at the U.S. Food and Drug Administration. She says the FDA does not regulate date labels except for when it comes to infant formula. For everything else, manufacturers use their own discretion for date labels. Main says most indicate peak freshness, not safety.
It really means that this is a quality date and not anything that you can't consume a product after that. And knowing when a product is at its best quality is not really an exact science.
The inconsistent labels are now prompting the FDA to push for standardized terminology in your grocery store aisles. To help clear up the confusion, the FDA recommends that food makers use the labels best if used by for freshness and use by for perishable items, things that spoil, like milk. The agency hopes the distinction will help with safety and food waste so you know when to keep food and when to toss it out. Before eating expired foods, Maine says there's one situation to pay attention to: spoiler alerts. Look for changes in consistency or texture. Smell it. Does the food have a foul odor? Other tips to help reduce food waste: if you can, avoid bulk and impulse purchases, especially of produce and dairy products, which go bad faster than shelf-stable items. When eating out, if you have leftovers, try to refrigerate them within 2 hours. And remember, your freezer is your friend. It'll keep many foods fresh until you're ready to eat them. Good advice with no expiration date.
And speaking of food, some doctors are using a new tool as a preventative measure to help patients with diet-related diseases, so-called produce prescriptions. Shomari Stone reports.
It makes it very easy to get fruits and vegetables.
Benedicta Awatefe immigrated from Nigeria with her 2 young children.
I'm a little new in the States. I don't really know what most of the vegetables are called. With the program, they teach you different ways you can put it in, and even the kids come back to tell you, can I take the bananas and the fruits?
Benedicta is now raising her family in a country where 1 in 5 children and adolescents are obese. About 14.7 million kids. She says she will take all the help she can get and is glad the produce vouchers are helping.
I think the last time we came to the doctor, we didn't have to come back again. The fruits and vegetables help.
Fruits and vegetables have myriad benefits.
Dr. San Veeradatchalam is a physician with the Children's Hospital of Philadelphia.
Your heart sounds good.
Referring patients like Benedicta and her kids to produce prescription programs. She focuses on families most at risk and says food plays a critical role in development and overall health.
So for instance, diabetes, heart disease, cancer, when you look at the burden of lifestyle-related chronic disease in the United States, much of that can be prevented really by eating healthy on a daily basis.
We really believe that food, since it's so connected to health, that it should be an integral part of healthcare.
Julia Koprak is with the Food Trust, a nonprofit partnering with the hospital to provide food vouchers to patients. She says produce prescription programs can lower costs for healthcare providers.
And if you can treat these issues using food rather than treating chronic illnesses down the line that are enormously expensive, we can identify this now and give people foods that they like and that they need.